Hi, my name's Pip.
And my name's Claire.
And we're both physios, and we're going to do a Q&A style video to answer the most common questions we get from our patients. This video is going to answer questions about endometriosis and how that relates to physiotherapy. So Claire, what is endometriosis?
Endometriosis is a condition that affects about 1 in 10 Australian women, and it's a genetic condition, we think. We're not really sure what causes it. It's characterised by things like having very heavy bleeding, really strong pain with your periods, and often difficulty conceiving a baby as well. And what happens with endometriosis is the tissue that lines your uterus is called the endometrium, and sometimes cells that are like this tissue start to grow elsewhere in your body. So that might be in the pelvis, so around the uterus, around the bladder, around the rectum and the adjacent structures. And that can cause real problems because every month when you have your period and you get the hormones that tell your body to bleed, for these cells to bleed, the same thing happens as is happening to the uterus lining with these cells elsewhere in the body. So it's not quite like this, but you can think of it as like a little wound and then a little scar elsewhere in your body every month that you have your period. And so that can cause a cumulative effect where there's more and more scar tissue in the body, there's more and more restriction on these structures, there might be affecting the nerves in that area, so that can cause pain, and it can block up or cause obstruction in the structures that are really important for conceiving a baby, like the fallopian tubes, the ovaries and parts of the uterus.
So what symptoms might somebody have if they have endometriosis?
Yeah, so some of the symptoms that I mentioned before. So women with endometriosis fall on a spectrum of symptoms from the mild to the severe. So you might have no symptoms at all, and you might not even know that you have endometriosis until you maybe have difficulty conceiving a baby for the first time. Or you might have very heavy, very painful periods. You might have an irregular cycle. You might have back pain, pelvic pain, difficulty with intercourse as well because the pelvic floor muscles are tight because of this ongoing aggravation month after month. It's really common that people with endometriosis will have gut issues like IBS, like symptoms like bloating and cramping and constipation and things like that.
So what impact can endometriosis have on the pelvic floor?
Yeah, so the pelvic floor, because it's so close to the structures that are most often affected by endometriosis, so the uterus, the bladder, the bowel, these are our pelvic organs. The pelvic floor is designed to support those organs and also to provide you with continence, so make sure you don't leak from the bladder or bowel at unwanted times. So if around that area there's a source of pain or a source of irritation to the nerves, the muscles, the skin and the other structures that are there, then the muscles are going to spasm as a protective response. And so that's often part of the reason why women have symptoms like constipation or pain with sex, that the pelvic floor muscles are actually really tight all the time. And the other effect of that is that it can pull the body out of alignment so that the hips have trouble centering in the socket, the pelvis has trouble doing its normal movements, the lower back gets very tight and stiff as well. So often if we're seeing a patient who has pelvic pain that's been there for a long time and they've kind of had treatment to their back or to their hips or to their pelvis that's kind of gone part of the way, sometimes we find that a really tight pelvic floor that's never been treated is the underlying reason why they haven't got better.
How can physios help someone with endometriosis?
So physios look at muscles. We look at muscle lengthening and contraction. We look at muscle balance throughout the body. We're also really good at analysing movement and at retraining movement. So if you have endometriosis and you've developed particular ways of holding your body or particular patterns of muscle gripping and activation that are perpetuating your pain, then physios can analyse that movement pattern and try and teach you a new one. So we might use manual therapy techniques to help muscles and joints lengthen and move better. We often use exercise to help you learn how to hold your body in a good way that doesn't cause you pain and spasm. And then the pelvic floor side of things is taken care of just by women's health physios who have special training. And we might look directly at the muscles of your pelvic floor and help you learn to relax them, to gradually lengthen these muscles and try and decrease some of that spasm that might be increasing your pain and symptoms.
If I think I have endometriosis, do I need to see a specialist before seeing a pelvic floor therapist?
If you're having symptoms and you think you might have endometriosis, it's a good idea to go at least to your GP and discuss those symptoms, as sometimes pain in the pelvic area, heavy bleeding, irregular cycle can be related to other things that aren't endometriosis. So it's a good idea to at least discuss that with your GP and hopefully rule out any other serious conditions. However, it's important to understand that the diagnosis of endometriosis, which is made usually by a gynecologist, a specialist doctor, is based on, generally, a pattern of clinical symptoms. The only way that they can definitively say whether or not you have endometriosis is by doing more investigation. And the best investigation is a laparoscopy, which is surgery. So generally, if you go to a gynecologist before you see a physio and you have a clear clinical diagnosis that's based on your symptoms, yes, that will help us to know that this is what we're dealing with and to guide you more specifically about how we manage your treatment and your symptoms. You don't have to see a specialist before you see a physio. You don't have to see a doctor. Your physio may well recommend that you go back to the doctor or that you see a doctor in the first place if she or he has any suspicions that there's something else going on. But I generally would say, yeah, if you think you have endometriosis, go and see a gynecologist, get a definitive diagnosis as best you can, and that will help any physio who treats you guide you better in the treatment that they give you.
Hopefully you found these videos useful. Please share them so other people will see them. And if you have any questions, you can drop them in the comments below, or you can contact us via Facebook or via our website, which is www.sydneyadvancedphysio.com.au. If you'd like to make an appointment, you can do so via our website, or you can call us on 9416 4410.